The Center for Emergency and Crisis Management on Medical and Public Health Response has completed its preparations to deal with the situation that the Sultanate is witnessing due to Mekunu storm. All arrangements are in place to deal with emergencies in the governorates of Dhofar and Al-Wusta. Some of these arrangements have already been implemented, where some of the patients have been transported by Royal Force of Oman to the health institutions of various governorates. This was necessary precautions procedure taken for their safety. We asked His Excellency Dr. Darwish Al-Mharbi and the Secretary of Administration and Financial Affairs on overall preparation, and he said,
well, obviously, like any other unit in the government, a number of arrangements have been made so far, and these probably I will put them in three different levels. The first one will be on planning. As you are aware, we are part of a big network in the country, and the department concerned with this particular issue has been working very hard from the moment they received the notification of the cyclone. And obviously they have their own mandate, they have their protocols, they've been following that, and this is something that they do all the time in such situations. And the most important thing is actually to look into the most important aspects. First, they have to look at the patients in hospitals, because they need to mobilize, from some of the hospitals. And you must have heard that has been already secured, and they are now in safe places according to their, the different cases that they have. The other thing, that obviously, in such cases, they have to think about the nitty-gritty also of the things that we do in the ministry. First, they have to look into things like renal dialysis, for example. They need to be also taken care of. That has been done already. They need to look at the engineering aspects. These facilities have to be secured. They have to be looked into. There are lots of equipments and materials in hospitals that need to be taken care of. They also have to look at the blood bank, because in such eventuality, you also need some arrangements should there be any need in the coming few days. So these things have been already done. But I think the most important part of the interventions that were done by the ministry is this very important collaboration with the effort that has been taken nationally, that has been done eloquently so far. And the teams are undertaking the responsibility of putting together all the efforts from the Ministry of Health. As you are aware, there are lots of facilities for the ministry in the Dhofar region. They need to be coordinated. These efforts need to be also coordinated with the other efforts taken by other units. This has been done so far, and I think it has paid dividends so far. So much has been happening.
It's worth mentioning that teams of specialists, doctors, nurses and other healthcare team are working around the clock to control the situation. Abdullah bin Ahmed Rubaiey, Sultanate of Oman Television, Muscat.